And there is some progress in North Carolina when it comes to getting doses of the COVID-19 vaccine to people.
But some state legislators say they still want to ensure the process is fair and that proper planning is being done for the next group who gets access. CBS 17 Capitol reporter Michael Hyland live in Raleigh. And Michael, the state has been trying to speed up this process after a slow start.
Right. State lawmakers I talked to here say they do want to still have some oversight with this process to ensure that when issues come up, they're actually being addressed. Dr. Mandy Cohen says the challenge now is with so few doses coming here, making sure there's access across the state.
I've been waiting for that moment.
In the first weeks that people could start receiving the COVID-19 vaccine, Republican State Rep Ed Goodwin was worried by what he saw.
When we started off in Chowan County, it was a mess. My 96-year-old mother went to get a vaccine, and she sat in the car in line for 5.5 hours.
With the help of the National Guard in the northeastern part of the state, he said things got better by the time it was his turn.
I think we're getting the kinks out of it now.
After ranking among the slowest states to administer shots, Dr. Mandy Cohen said the state focused recently on speed. By the end of last week, the CDC said the state was 12th in the country for the rate of first doses administered to people. All of the first doses that providers in North Carolina received actually have gone to people. But that also came with concern, as some communities had their allocations cut. Is that coming at the expense of everybody getting a fair shot to get the vaccine across the state?
It is right to say we have to look at both speed and equity. And I think that's why our allocation process going forward, now that we've cleared any backlog, our allocation process going forward really is focused on both.
She says the state will get about 145,000 doses each week the next 3 weeks. 90,000 gets distributed based on county population, with the rest targeted toward areas with higher concentrations of people over 65, marginalized communities, and large vaccination events.
Fairness is the big point.
State Rep Robert Reeves says there's also pressure to get these vaccines out, given the more contagious variants of COVID-19 spreading.
We understand that they want to make sure it looks fair and that it is fair. But on the flip side, we've got to get doses out.
Dr. Cohen says demand is still high among people currently eligible. So looking forward to the next group of people, frontline essential workers. She says with the supply being so limited, they likely won't get to all of them even in the first several weeks that it's available. State lawmakers here want to make sure that when Group 3 does become eligible, they don't run into the same issues people did when the rollout started. Live in Raleigh, Michael Hyland, CBS 17 News.